In this tutorial, we're going to be looking at sports massage therapy for shoulder pain and tightness. And as you can see on the screen, we're going to be looking at our 3 bullet points, which is potential muscles involved, trigger points, and compensations. So any residual tightness that spreads away from the area. So again, we're not going to be talking about any injury specifically. That would be needed to go through an assessment, a consultation process to find out where pain is coming from, where potential knots and tightnesses are. So we're just going to sort of hit it with a broad brush, talk about a lot of different muscles, different trigger points and where the pain can go, and then any residual tightness that we may need to look at as well. Looking at 5 muscles, we could look at more, but we're just going to stick to 5. We've got supraspinatus, infraspinatus. They're 2 rotator cuffs. I'll show you where they are in a second. Trapezius, pec minor, and then deltoid. And what I've tried to do is put an image for each. So we've got supraspinatus up here, which is essentially on the top part of the shoulder blade. So you should be able to feel there's like a ridge there at the top of the shoulder blade. It's over the top of that ridge and sort of sunk down in. So you've got to go through the trapezius to get there. Then you've got infraspinatus, which is essentially on the back side of the shoulder blade. So if you know where the shoulder blade is and you press on the back of it, that's the infraspinatus. Trapezius is the big muscle which basically kind of goes from the base of the ribs all the way up to the skull and then all the way out to the shoulder, and basically every single vertebra in between. Pec minor is on the inside portion of the shoulder, so the front of the shoulder. But it's a deeper down muscle, and again it joins onto the front of the shoulder blade. So again, a lot of these we're talking about the shoulder blade, the shoulder girdle, and then we've got deltoid, which is the final one. You've got the red bit here, which is the anterior part. Then you've got the medial part as the green, and then blue on the back. So we've got all these different parts of it. Now again, as I've mentioned, which muscle it is will depend on the initial questionnaire, the consultation, the assessment. How then it's then treated specifically, again, will depend on that. What movements are restricted? Is it external rotation, internal rotation? Is it shoulder flexion, shoulder extension, so on and so forth? So there's all these different things that it could be. Could be depending on how the pain feels. Could it be a nerve pain? Could it be a sharp pain? Could it be an aching pain? So all these different variables go into the mix to help decide what we need to do about it. But as a general rule, these are the muscles that we are kind of looking at. When it comes to trigger points and how the pain can sort of move around the body, so supraspinatus, you may experience pain out in the deltoid and potentially down the arm as well, and you can see just there, just the other side of the elbow as well. And as you can see, you've got the 2 trigger points, which are the 2 crosses, again down in that groove on the top of the shoulder blade underneath the trapezius. When it comes to infraspinatus, there are 3 on there. One is very close to the medial border, which is the very inside of the shoulder blade. And you can see here that is on the inside of the shoulder blade, so the pain goes up just on the inside of that shoulder blade. So that's very similar to when we were talking about neck pain. You can start to see how these trigger points cross over. So it might be, okay, you've got pain there, but is it coming from shoulder blade? Is it coming from up in the neck? That again is something that we need to find out, which could take consultation, as I've mentioned, questionnaire, consultation, assessment to find that out. Potentially as well, a few treatments. Then what we've got are 2 other trigger points, which are more to the top of it. And these are going down the inside of the arm. So this could be mistaken for anterior deltoid, pec minor, potentially bicep as well. So those are the 2 trigger points on the outside of the shoulder blade. But again, that would need to be investigated. When we talk about trapezius, again, very close to the neck, but this time it is a muscle of the neck and shoulder, really, I should say. So we know where it joins. It's the sort of the base of the rib cage all the way up the back, out to the shoulder, and then up into the neck. So it's this whole area here, but you've got 2 trigger points there. And again, this goes up through the neck, into the head, and then potentially into the jaw as well. So you can hopefully start to understand that when I was talking about neck pain and tightness, there is a crossover, because some of the pain signals can be the same, but we need to obviously look into it and find out where it's coming from. If it's directly on the shoulder, in fact, if we go pec minor first, this might be the anterior part of the shoulder, so the front part of the shoulder, and then finally with the deltoid, what we've got back of the shoulder, we've got middle of the shoulder, and we've got also again middle of the shoulder. But again, depending on where the pain is will depend on the trigger point that is worked on. And as you can see in this diagram here, there are trigger points on the inside, on the anterior, the front, on the posterior, and in the middle as well. So it's one big investigation to understand where all that's coming from. There may also be range of movement restrictions that need to be worked out. And again, with range of movement restrictions, that will point towards certain muscles as well. And then we could even look at the whole system, working all the way out, spine, shoulder girdle, shoulder joint, down the arm, so on and so forth. But I'll explain that in the next slide when we talk a little bit more about compensations and residual tightness and other muscles in the area. What we're basically doing here is looking at muscles above and below the shoulder. So we're talking about bicep, tricep, scalene. If you've watched my neck tightness one, scalene, sternocleidomastoid, levator scapula. So again, if we've got trigger points, if we've got tightness going through any of those muscles that we've talked about before, pec minor, trapezius, infraspinatus, supraspinatus, we can start to understand the crossover between these two and how they are linked. Because if you can remember, we had pec minor, which comes off the ribs, goes up to the shoulder blade, which is similar to one of the bicep insertions. So we can get a residual tightness going through that system. We've then got tricep. As you can see here, one of the tricep heads, again, joins onto the shoulder blade. So when we would then, if you want to talk about further treatment, we would be talking a lot about stabilizing the scapula, stabilizing the shoulder joint, because one of the most basic ways that the body is able to manage instability is just to tighten everything up. So if there's tightness in certain areas, could be tricep, could be bicep, it could be because of instability through the shoulder joint. So if you have unstable shoulders or tight shoulders, then it could be that the biceps and the triceps are playing a role in that, in the fact that there is residual tightness there. Then we go in the joints, the muscles above the joint, and we go through the scalene. As I've talked about before, you've got the anterior at the front, medius in the middle, posterior at the back. You've then also got sternocleidomastoid going all the way up through the side of the neck, front into the sort of side of the neck, because it goes up in behind the ear, as you can see here, just there. And then again, levator scapula in this area here, joining the top of the shoulder blade. Again, another one on the shoulder blade, into the vertebra of the neck. So what we are talking about is no specific area, but if we wanted to, and sometimes I will work with people, I will just work through the whole system. So if they have pain in a specific area, I will start there. As that starts to reduce and we understand that there is a range of movement issues through the thoracic spine, because if the thoracic spine can't extend and rotate properly, that can then have implications on the shoulder girdle, the shoulder blade, the collarbone, and the collarbone also. And what it can also do is then restrict into shoulder joint and then down the arm. So it can be a case of just going through that whole system and just trying to relax that whole system, get that whole system moving a little bit better. So whether it is instability in the shoulder blade, whether it's lack of range of movement at the thoracic spine, whether it's a trigger point, or whether it's an actual injury to a certain area of the body, that will all need to be better understood with regards to initial questionnaire, which is what you would do when you first come to see me or first start the process to come to see me. Would be initial questionnaire, I prep, we get you booked in for the consultation, then the assessment, which is or consultation and assessment and treatment. They're all in one session, and then we come back for a second session where we review what we've worked on, and then also start looking at the compensations and around the different areas of the shoulder. So hopefully that gives you a better idea of the shoulder joint, the shoulder girdle, the muscles involved, and shoulder pain and tightness around those areas, and potentially some ideas of what you could possibly start doing with regards to being able to manage it or treat it yourselves. Otherwise, just get in contact. We'll be able to book you in and get you pain free. So many thanks for watching. My name is Chris from Chris Pole Training. I'll speak to you in the next tutorial.